Do you have some type of back, butt, or sciatica pain or experiencing weakness in your leg as a result? Maybe in the calf, the ankle, the foot, the hamstring, the glutes, or just the whole leg feels sort of different or fatigued than the other side. And will strengthening help? And it's a very good question. In this video, we're going to talk about how to tell if strengthening is useful or not. We're going to talk about how to identify sort of the root cause of the weakness, because that determines if strengthening is helpful or not. And then where to focus your effort and your energy as you're trying to increase your strength. Hi, everyone. My name is Dr. Charlie Johnson, physical therapist. Appreciate you checking out this channel. I share with you here some data to let you in on the fact that this information you're about to hear comes from someone who works in the trenches with people who are dealing with back, butt, and sciatica problems every single day. Knowledge and experience places me within the top 0.5% of PTs in the USA alone. I'm a doctor of physical therapy. I'm residency trained and have my board specialty in orthopedics, and I only help people with back, butt, and sciatica issues. Definitely don't know everything, but I've worked with over 10,000 people with these issues. And so know that this information comes from a place of knowledge and working in the trenches and having a lot of experience with folks like you. All right. So the overarching sort of hypothesis, right, or question at the origin or the root of this video is, Dr. Charlie, I have some type of back, butt, or sciatica problem, and I feel weak. So if I feel a loss of strength, or if I experience weakness is another way to say it, then strengthening will make me stronger. Right? So we have this hypothesis, the question, right? And then we have this experiment that we want to run, or maybe you're considering running this. You're trying different strengthening exercises, or you're considering trying different strengthening exercises to make you stronger. Does it make sense or does it not? Really, at the root of this is that the success of strengthening depends on what's causing the loss of or the lack of strength, the weakness. Because in truth, if the loss of strength is caused by nerve compression, then strengthening will not restore the strength. You see, when most people consider or use this term strength, they're speaking about the strength of the muscle. But you have to ask yourself, what gives strength to the muscle? Is it the muscle itself, or is it the juice that fuels the muscle, or that feeds the muscle, right? And where does that juice come from? It comes from the nervous system, right? And so if there's a problem with the nerve, then you can try to strengthen the muscle all you want, but it's not going to be getting the horsepower that it needs, all right? And again, in this case, strengthening will not restore the strength or the weakness that you're experiencing, all right? But if a loss of strength is caused by disuse, maybe you've been laid up in bed for many months, or pain, which often inhibits function. If it hurts to walk, for example, well, I'm not going to be utilizing those muscles probably as naturally as I would if it didn't hurt to walk. And so you may see some inhibition of your ability to, or lack of ability for your muscles to work in a very natural way if you experience sciatica pain. Then strength training might be helpful. All right. And so again, in this video, we're going to kind of walk through how you determine what's actually causing strength loss and then what it means for you. All right. So you're going to learn the two types of sciatica and the one that causes loss of strength, like a true loss of strength, often very sudden as well. The difference between true weakness and perceived weakness and how to determine what you have. Why isolating the cause of weakness matters. Strength training can be a waste of time if you don't do this or you skip this step. And how to tell if strengthening is something that is best for you or not, right? And then where to focus your energy so your nervous system can recover, all right? So real quick, sciatica is a broad term used to describe a problem with the nerve roots, which make up the sciatic nerve, L4, 5, S1, S2, S3, right? And you can see here, I have this beautiful picture I drew, right? L4, L5, S1, S2, S3, and these nerves come together. They form a thick bundle of nerves that go through your buttock all the way down your leg to the bottom of your foot. This is the sciatic nerve, all right? And you can see here, if you have a problem with the fourth nerve in the back, well, then you're going to have some symptoms maybe in the back and maybe even in the butt. But you're going to see that a lot of the symptoms might go towards the front of your hip. So maybe you have a psoas weakness, or hip flexor weakness, or thigh weakness, and maybe some numbness and tingling even into these areas. That is because that is the nerve that correlates to this region. This is the nerve that plugs into those muscles kind of on the outside of the hip and then the front of the thigh. If you have a problem with the fifth nerve in the low back, which is actually the most common level of nerve issues in the spine, you will see that symptoms are not generally located in the front of the hip. Weakness will be located in the hamstrings. Also, you can see it wraps there, the shin muscles. You might notice an inability to kind of pick up your big toes. And we'll talk more about strength testing specifically for an L5 nerve issue here shortly. But this is where you'll experience symptoms and then also weakness. If you have a problem with the first sacral nerve, the S1 nerve, then there will be essentially nothing or very little in the form of feeling loss and or strength loss in the front of the hip or the front of the leg, but you'll see the calf and or some symptoms even into the heel and the foot might be more present. Sciatica commonly causes weird feelings. It may feel hot, cold, like water's trickling down the leg, ants crawling around, or it may feel burning and electric-like and tingling. I probably don't need to tell you that, but these are all normal when dealing with sciatica. But the difference here, and why it matters in the context of this question of should you strengthen or should you not, is that the difference is that some folks with sciatica will actually lose their ability to function, not just due to pain, but actually lose nervous system function. So true feeling and strength loss, right? So weird and funky feelings and pain are one thing, but true loss of feeling and strength is another, all right? And so there's essentially two types of sciatica for sake of keeping this super simple, all right? You have what we call radicular pain, all right, which is basically where your nerve becomes sort of ticked off and angry, right? And this is nerve pain without or with the absence of weakness. So there is no weakness in the leg, but there's nerve pain. There's a lot of shooting pain, burning pain going down the leg, usually in a very narrow band, usually worse below the level of the knee into the foot. And this is caused by inflammation of the nerve root, L4, L5, S1, and L5 being most common, followed by S1 and then L4. Usually a disc, the material inside the disc can cause a chemical inflammatory process to the nerve root and can cause these types of angry nerve symptoms, sciatica symptoms, pain, numbness, tingling going all the way down the leg. In this case, again, without weakness is the key here. So radicular pain is classified as the presence of pain without weakness. So this is where I say subjective feeling or strength loss. This is perceived feeling or strength loss. You might say my leg feels a little bit funny, right? Occasionally feels tingly, or I have these weird sensations and it feels kind of weak, but it probably feels kind of weak because it's painful, right? And you maybe don't want to use that leg as much, not because it's truly weak, all right? We'll talk more about this. The other type is what we call radiculopathy. So radicular pain, just pain. Radiculopathy, you may or may not have pain, but really weakness is the hallmark of this. Objective loss of feeling and or strength loss, actual or true feeling or strength loss. It doesn't just feel weak, Charlie, it actually is weak, and we'll go through some tests here to help you determine if this is what you have, because again, this plays into whether or not you want to strengthen or not, all right? And this is where you actually have like what we call a nerve conduction block. The nerve or the wire, you want to think of it like that, is not getting all the signals through to the end unit, which is the muscle, right? It's no wonder you can't fire the muscle no matter how much you try. You can't go up on your toes, you can't walk on your heels, you can't do all these different things, and the nerve or in the muscles are actually weak, not because they themselves are weak, but because the wire, which is giving it the juice that it needs to function, isn't able to do so. All right, so nerve signals are blocked. There's maybe some type of compression somewhere along that nerve pathway, L4, L5, S1 being the most common. So weakness with or without pain, radiculopathy, there has to be an objective loss of feeling or strength. So you're probably here because you have lumbar radiculopathy, or maybe that's what you think you have. I have weakness is often what people say, but do you really or do you not? All right. So in this case of sort of this unhealthy nerve, this lumbar radiculopathy, the nerve may be experiencing some type of compression due to swelling or another structure. When I say may, it is experiencing some type of conduction loss. So something is blocking that. Now, it could be a disc, it could be bone, it could be something else, right? But the idea is something is causing pressure on the nerve to the extent that some of the lanes are closed down. So to help you understand this, think of the sciatic nerve at a micro level like a highway. Nerves are like highways, right? But instead of traffic flowing down them, you've got information such as feeling to the skin, so sensory fibers, your ability to sense things, right? And movement fibers or motor fibers to the muscles. Right? So you have this energy without being plugged into a nervous system. You could try to move your hand, but if it doesn't get the juice it needs from the wires that come out from the spinal cord, then guess what? It will not work. All right. So muscles in themselves cannot contract. You need a power source, and that power source is the nervous system. All right. So you've got motor nerves, which supply the muscles, give them the energy they need to contract. And these are the things that are traveling down these highways or these lanes, so to speak, right? And so if the nerve is healthy, then all lanes are perfectly fine. Feeling and strength is normal, and nerve conduction, sending of those signals and the speed at which those things are traveling down that wire, the signals in this case, sensory and motor, is completely normal. So if you have a nerve test, an EMG, nerve conduction, velocity test, maybe you've had some of these things to rule this in or rule this out, right? It's going to say it's normal. You're going to say, well, I still hurt. Well, that's just evidence that you have an angry nerve, all right? An angry nerve, sciatica, doesn't mean that you necessarily have a pinched nerve, all right? You can have a very ticked off or inflamed sciatic nerve, which still everything is firing just fine, and you're not losing true strength, but you might have a lot of pain and funky sensations, all right? So this would be sort of an angry nerve or a healthy nerve in this case, where signals are firing just fine, right? But an unhealthy nerve, lumbar radiculopathy, right? Some form of compression along the nerve leads to closure of the lanes, which prevents some of these nerve signals, sensory or motor, so feeling or strength, to be affected, or both, from getting to its target. And as you can imagine, right, that affects how well these, the skin feels things, and then also affects how well the muscles function. So because of this, the nerve begins to lose function. And really, no MRI or nerve test is needed, at least immediately, because we can test the function of these nerves to isolate what's happening and where it's happening within reason, right? So if we know, let's go back to what nerves are. Nerves are like highways to send information such as feeling and movement. If we know that nerves send these different functions down the path of the nerve to its destination, the skin that it supplies or the muscles that it controls, then we can test each of these things individually to make sure that they're green, that they're good to go. Now, again, you're watching this video because you're wondering, hey, I have this weakness and should I strengthen, right? And Charlie, you're spending all this time talking about this background stuff. Just tell me what to do. This background stuff is really important because are you truly weak? Is it due to lumbar radiculopathy, some of the nerve lanes being closed down, or is my nerve just ticked off? In which case, I'm not actually weak. I feel weak, right? But strength training will have a different effect on depending upon the status of what you're about to discover. All right, the status of your nervous system. All right, so are you truly weak or are you not? Let's check your strength. All right, so first things first, each level of the spine correlates to certain areas of the body and muscles, which what we call innervate. So certain levels of the spine plug into certain muscles in the body and give them the juice they need to function or produce power, strength, etc. All right, so the L4 nerve supplies primarily strength to the front of the thigh muscles, your quadriceps, all right, which help you get out of a chair. They help you get up and get down. They also help you go down the stairs. They actually decelerate you, or your thigh muscles are the brakes for you as you go down the steps. The L5 nerve gives strength to your shin and big toe muscles, which allow you to pick your foot and toes up, all right? And the S1 nerve, the first sacral nerve, gives strength to your calf muscles, or the muscles that allow you to go up on your toes, tippy toes. All right, so knowing that, we can segment each of these things out and do a basic strength test to see if there's anything clear, objective, and obvious there. All right, so we will test right and left sides of the body. That's what I recommend we do so we have a comparison, and take note of any weakness or differences, clear weakness or differences, by the way, in strength side to side. All right, so the L4 again gives the L4 gives energy to the quad muscles, and they help you get up and get down. So we're going to perform what we call a single leg sit to stand. We're going to do this on the right side and the left side of the body to determine if there's a clear and objective difference in strength right versus left. Let's do it. All right, to test the health of the L4 nerve, we know that the L4 nerve plugs into the quads or the thigh muscles, so we're going to perform a single leg sit to stand. Now, this is a challenging motion for almost everybody, and if you have pain or you have weakness, it may be even more challenging. So what I would recommend is, this is just sort of a normal height chair, a folding chair. Maybe you pick a higher seat, maybe a bar stool, something like that. And maybe you pick a chair with either arms on the chair so you can kind of just assist yourself gently for balance, or pick a very large stick, all right, like this. And so what we'll do is we'll test it on the left leg first. So you're only going to stand up using your left leg. All right, so maybe just hover this one off the ground or something like that. And go ahead and can you stand on up for me?
Can I put it anywhere? Meaning, can I move it to the center?
You can put it wherever you want. Okay. And use this for balance, but just don't do your best not to push up with that, all right? We're trying to test the strength of this, all right? Okay. Go ahead. Can you do it? Very good. And down. All right. Now go ahead and we're going to test the other side, all right? So she knows what the right one feels like. Now she's going to test it. And you want to keep it on the right there? I would move the stick to the other side. Okay. You can do whatever you want, all right? But I would generally hold the stick on the opposite side when you're doing this if you need a stick or a walking stick or a cane or something like that. Go ahead. Very good. Cool. All right, now generally what you'll see if the L4 nerve is a problem is you'll see that one side goes really well, so go ahead and stand up on that side. Woohoo! No problem, right? And then when you go to do the other side, if this leg had a problem, what you would see is he's supposed to make it hard. Like, right? You'll see that it's just significantly weaker on that side. And again, it should be very clear and obvious side to side. Sit to stand test the function of the L4 nerve or the quad muscles, basically the juice that is getting the muscles such that they can help you get up. All right, now the L5 nerve gets power to the muscles in your lower leg shin muscles, right? And so we want to see, can we activate those muscles or turn those muscles on? And again, is there a difference side to side? This is going to be a little tough to tell, but we can perform something called heel walking. And generally, in my experience, it's very obvious when somebody loses power to this because you'll see something like foot drop or their foot will slap when they go about doing heel walking, which I'll show you here in a second. Okay, so to test the health of the L5 nerve, which comes down the back and supplies these shin muscles right here and the big toe muscle, what you're going to do is attempt to lift your toes off the ground on both sides and just kind of walk. You can walk in place like that so you don't walk into me. There you go. And what you'll notice if there is a clear difference in strength side to side, again, this should be very clear and objective, is that one foot you'll be able to pick up and the other foot will just kind of drop down. So yeah, you'll notice that one foot kind of slaps. You might even notice this if you're walking. The sound, if you're walking on tile or a hard surface, it might just sound different because the one foot is going to be hitting harder than the other foot. And that's generally due to lack of control in the front of the shin due to an L5 nerve problem or other problems. But for the sake of this video, an L5 nerve problem, which causes foot drop, foot slap, weakness in those muscles. Heel walking. S1 nerve gives power to the muscles in the back lower part of the leg, so the calf muscles and other muscles that allow you to go up on your tippy toes. So what we can do is we can compare calf raises on one side, or ability to go up on our toes on one side compared to the other side. And again, this should be very clear. Most people who have lumbar radiculopathy or compressed sciatic nerve, specifically the S1 branch of it, will barely be able to get their heel off the ground, and you'll notice a significant difference side to side. So let's demo this test again, right side versus left side, so you can see if there's a clear and objective difference. So to test the health of the S1 nerve, which supplies energy to the calf muscles, or the back compartment of the lower leg, you can do toe walking if you'd like. So go ahead and walk around your toes. And what you'll notice if there's a clear difference is that one heel will drop as you put load onto that foot. Very good, right? Or turn around and face the wall completely. Hold on to the wall. Again, this is not a balance test. And what I want you to do is just go up. We'll say the right leg is your good leg. Go ahead and just do single leg heel raises on the right leg. Perfect. 1, 2, 3. And the cool thing is this is a little bit easier to objectify because you can do, say, 5, 10, 15 reps until you get tired on the good leg. But then go ahead and do it on, quote unquote, the bad leg. And this is what you'll notice. Go ahead. Ugh. Yeah, it won't go very high. And oftentimes people will go up just like an inch, right? And they'll notice, it just doesn't go. And they'll have to drop their heel back down, right? So that's how you test the health or the function of the S1 nerve. And again, there should be a clear and obvious difference if you are dealing with lumbar radiculopathy, in this case of the S1 nerve. You test it out via calf raises or heel raises and or toe walking. Okay, so now you've gone through those different tests. The sit to stand for L4, the L5 heel walking test, and then the calf raises, going up on your tippy toes to test for S1 issues. Is there an objective difference in strength side to side? Maybe half of you, right, will say, absolutely, Charlie. You know, when I tried walking on my heels, I noticed there was a clear difference. Or when I tried going up my toes, the one side went really well. The other side, I could barely budge it, right? I could barely get my heel off the ground. Others will be watching this and say, hey, I thought I was weak, but actually, and I feel weak, but actually all those tests were fine. And if that's the case, then there is no objective difference. There might be a sensation or experience of weakness or lack of strength. But it's probably because you're dealing with pain, right? When you go to test out these individual muscles, S1 and the muscles associated with that, L5, heel walk, and the muscles associated with that, L4, sit to stand, right versus left. If there's not a clear objective difference, then you may feel weak, but it's not due to loss of function or compression of the nerve. And this is going to matter a little bit when we get to talking about if you should strengthen or not. All right. So again, if you're watching this and you do not have differences in side to side with any of those tests, very clear and objective differences, not just like, oh, it's a little bit weaker, like something very obvious, then you have most likely radicular pain. So you still have irritation or inflammation of the sciatic nerve and its associated nerve branch or nerve branches. But again, you're not seeing actual compression of the nerve. And so it's more of a subjective feeling of weakness or of feeling loss instead of an objective loss, which is the opposite, okay? Or the other side of the spectrum, which is like, hey, yeah, I've got maybe some pain, but I actually have weakness. And I notice a difference in one of those tests side to side, but maybe you don't have pain either, and that's okay. So this proves, if you do those tests, there's a clear difference side to side, that you have what we call radiculopathy, or at least that's what it's presenting as, or something very high on the diagnostic list. And nerve signals, for whatever reason, are being blocked along that specific nerve root. And this is, again, defined as an objective loss of feeling or strength. In this case, we're talking about strength, which case you have actual strength loss versus if you did these tests and you did not have differences side to side, then this is a perceived weakness. All right. So should you strengthen? Now let's answer this and let's have this discussion. Right. So if there was no clear difference side to side in strength, it proves that your nervous system is in fact intact. It might be ticked off, but it's intact. There is no actual pinching or compression or loss of nerve conduction. All the signals are getting to the muscle, are getting to the skin, are getting to exactly what it needs to get to, right? Then, I mean, you could strength train, right? Weakness is not caused by the blockage of nerve signals, but maybe due to disuse or secondary to pain. Maybe you just don't want to use the muscles as much because it hurts. So strength training is something that you can do and you can potentially see value from if your goal is to increase strength. Now, the reason I say if your goal is to increase strength is because my guess is that if you're here, you might have the belief that you need to increase strength to get out of pain, but the problem is they're not really correlated. Lots of people believe that if they increase strength, then they will reduce their pain, but we see very little correlation between the two. So do you want to increase your strength or do you just want to get out of pain? Different objectives. All right. So again, in this case, all the signals are going down the nerve just fine. It probably just hurts. Again, you could strength train the muscle, in this case, the steak, the meat, right? Because everything is supplying it with 100% horsepower or energy. But again, just be careful here, because if you're doing strength training, right, and it's kind of hurting so good, then consider you may be doing more harm than good. We know that there is not much correlation at all between strengthening, say, your core, right, and reducing pain. All right. Now, core is just one area. We see very similar results when we think about glute strengthening and things like that. Okay. So a little bit of a fallacy or a myth there that I just want to help you break. If you're like, hey, I've got to be strengthening, even though it hurts so good, I was told I should strengthen, but as I'm strengthening, I'm noticing my symptoms aren't improving or I'm getting worse. But because I have this belief, which informs my actions, which informs my results, well, I'm holding tight to this belief. But if you're not getting the results you want, then you might want to challenge this. And when I say challenge this, right, understand the evidence does not clearly correlate changes in strength and reductions in pain. Now, if, left the meat on there for some reason, all right, if you have lumbar radiculopathy, right, and there is a clear weakness element side to side, then weakness is caused, or most likely is caused, by blockage of nerve signals for some reason. Right? Again, the cause could be disc, it could be narrowing of the spaces where the nerves travel, stenosis, it could be many different things. Then strength training is not something that I'm going to recommend as the primary intervention. All right, the primary treatment strategy is not where my focus is going to be if you have objective strength loss. And the reason being is that, again, the muscle is fine, right? But the reason that you're weak is not because the muscle all of a sudden overnight or in the last week since you started to experience pain, or however long it's been since you started to experience symptoms. It's not because it just all of a sudden doesn't work. Not a muscular problem. The issue is that the nerve signals, the horsepower, the juice being sent to that muscle is reduced. There is compression. There is something that is preventing the passing of those signals, and therefore the horsepower to that muscle is reduced. You can try to strengthen all you want. You're probably not going to get the result that you're looking for. All right. So remember, I drew this picture right in the very beginning. This is sort of these are the branches of the sciatic nerve: L4, L5, S1, S2, S3. We see that L4, L5, S1 supplies feeling and then power to the leg. L4, the front of the thigh. L5, kind of the butt, the lower leg, the shin. S1 to the calf and mostly the back of the leg. All right. And so to help you understand why strengthening may or may not be valuable to you, especially if you notice weakness when you were testing right versus left side, I want to kind of use an analogy. All right, so L4, L5, S1, imagine each of these were switches. Right, so you've got switches in your house, the L4 switch, the L5 switch, and the S1 switch. All right, and each of these switches has a wire, right, which supplies these lights. Right, assuming that the wires are fully functioning, all the signals, all the electricity is getting down the wire to the end, to the light that it supplies, or to the lights that they supply. Then when you turn on the switch, right, everything is going to be sent exactly to where it needs to go, and the light will turn on, right? So L4 in this case is working. L5 in this case, you flip the light on, the wire is fine, everything is healthy, boom, the light pops on. But then you have one of these cases where you go to flip the light on, it's just not working, on, off. You think maybe something's wrong with the switch, and maybe there is, maybe there isn't, but just recognize that if there's something wrong with the wire, it's not a light problem, right? It's that the wire is maybe not intact. Maybe a mouse chewed it up, right? Maybe there's some faulty connection there. But because the wire is impacted, the signals don't get to the light, and the light or the lights don't turn on, right? And so to now relate this to the body, right? L4. Assuming the wire is fine, the nervous system is healthy, and we know that those lights, or the quad muscles, the muscles in the front of your thigh, are exactly where that L4 plugs into, which allows you to go from sit to stand with ease, right versus left. Assuming that wire is healthy, you're going to be able to do that, right? Knowing that the L5 nerve plugs into the muscles that allow you to lift up your toes, you're going to be able to heel walk. Assuming the nerve and the wire is healthy and all those connections are good, then the shin muscles are going to be working well, right? But S1, just say we have a problem with S1, right? We're trying to walk on our toes, but it's just not working. Why is that happening? Well, if there's a problem with the wire, lumbar radiculopathy, there's compression of the wire, right? Then the calf muscle is not going to work. The muscles that allow you to go up on your toes are not going to work. The lights aren't going to turn on. Nobody's home, if you will. And it's not because there's a problem with the calf. The calf just didn't suddenly die. It's because the wire which supplies the juice there is not functioning properly. And so this matters because, again, you're going to be trying to strengthen the calf saying, I'm weak, I'm weak, I'm weak. But if the problem is not with the calf itself and it's with the wire, then the intervention needs to be focused on improving the health of the wire, or the nervous system in this case. All right? Now, once we restore juice to the wire, we remove the compression, we reduce the swelling, we find things that make you feel better, we optimize the healing environment, right? And we create a situation such that the nervous system can recover, then we flip it on, and all of a sudden the strength turns back on, right? It recovers, not miraculously, right? But we see it, the juice to the lights, or to the calf, to the muscles, starts flowing again. Because of that, you improve your strength, right? So to summarize, trying to strengthen weakness caused by nerve compression, lumbar radiculopathy, is like trying to turn on a light that's no longer plugged in, right? It's not that somebody cut your nerve, right? It's that if you have some type of compression, right? Usually this is temporary. You'll see that the end thing which that wire plugs into, the lights are sort of flickering. The lights aren't really going to turn on. The calf muscle may not be working as it normally does, right? You can try to strengthen that calf muscle all you want. You can try to turn that light bulb on as much as you want, replace that light bulb, but it's not going to work, right? And so it won't work yet, right? And the reason I say yet is that most of these things recover naturally with the right approach, right? Now, that being said, you could try it if you want, right? Research is pretty mixed. That strength training, the affected muscles, does not appear to have maybe a positive effect, but it doesn't necessarily appear to have a negative effect on recovery. Although, in my experience, forcing strength to an area which is trying to heal, again, the problem isn't the muscle, the problem is the irritated, inflamed, compressed nervous system, often perpetuates the problem because it continues to poke the angry bear, right? It continues to aggravate the problem and keep the inflammatory process going. So for anybody watching this saying like, well, hey, could I just strength train anyway? You could, But just recognize that if you improve your strength, it doesn't necessarily mean, right, that you're going to improve or reduce your pain, because those two aren't necessarily correlated. And you might be trying to improve your strength, but if it's due to nerve compression via the testing we just talked about, and you have a radiculopathy, then you're going to be trying to turn the light bulb on, but nobody might be home, meaning the nervous system may not be getting all the horsepower that you need to actually have a positive effect or to get the effect that you need from strength training, all right? Which might cause excessive soreness and overwork or overtaxing of that area. Not to mention, you risk aggravating the problem. So for example, if you're watching this and you're like, hey, I've been trying to strengthen my glutes, I've been doing clamshells, I've been doing bridges, I've been doing a lot of band work, I've been doing planks, different core work, calf work, hamstring work, foot and ankle strengthening to try to restore this thing. Well, now maybe you know why it's not being restored, right? Because most people try to start with movement as medicine. This is the 4-step pain relief process that we bring everybody through who decides to work with us. We work with people all around the world with back, butt, and sciatic issues. And first step, we optimize things. You cannot exercise the bad diet. Then we teach you to self-assess. And then we start using movement to solve the problem. Most people start here, but in the presence of an environment which is not conducive to your nervous system healing, you're going to be barking up the wrong tree, probably wasting a ton of time, energy, money, and or keeping yourself from getting better. So just be cautious about this, okay? Now, that being said, we have seen in rats or in animals, right? So I'm not sure we can transfer this to humans, but we have seen that voluntary aerobic exercise, such as walking, rats who walk on the wheel versus rats who are sedentary and don't walk on the wheel, tend to see increased nerve regeneration, right? Again, I'm not sure we can transfer this to humans, but that being said, the general rule of thumb still applies, right? So even though I might not be talking about specific strength training for you, maybe that's not the path you want to go, just recognize that we know that people who stay as active as possible generally do better than those who do not, for whatever reason, but stay as active as you can, all right? Now, that being said, where I would recommend you focus is that you optimize the healing environment mentally and physically, all right? Physically, let's talk about that. The primary focus should be on creating an optimal healing environment to restore or maximize nerve function. You want to aid in restoring the function of your nervous system, not try to hinder it, right? Or not inadvertently hinder it. A lot of times, that which people think they're doing, which is helping them, is actually keeping them from getting better, all right? So you want to identify, do some detective work here. Identify habits, routines, things you don't know that are keeping you from healing. I will link a video here so you can check it out where I go into sort of this initial concept, right, of taking your medical diagnosis, turning it into specific movements that you identify as being unsafe, threatening, or yucky, aggravating to the problem. Then ask yourself, how do those things show up in life? So click on this video. Again, I'll link it somewhere here. If you're wondering, how can I optimize my healing environment? Where do I begin? Right? Next thing is we want to remove any additional inputs that negatively impact the nerve's ability to heal. They're like picking the scab. All right. So active release technique, people digging their thumbs and moving your leg in extreme positions, which are stretching the nerve or compressing the nerve, right? If you have lumbar radiculopathy or even just an inflamed nerve, you want to know the best way to continue to reduce nerve conduction or reduce how well those signals are being transferred. Continue to compress your nerve that is already compressed, right? Or if the nerve is inflamed, continue to stretch it and activate those pro-inflammatory mediators and continue to stress it out, and you will continue to experience symptoms, all right? Digging an elbow into the butt cheek might look really cool, and it might seem like the person's really doing something, right? But sitting on a tennis ball, getting an elbow dug into your butt cheek around a nerve which is already unhealthy or angry is a sure fire way to continue it being angry in most cases, all right? Massage guns, Theracanes, all kinds of different balls, psoas stuff, foam rollers, tennis balls. These stretches, very cookie cutter stretches, if you're not careful, again, these will actually increase the inflammatory response in that they will tension the nerve, which reduces blood supply. Why do I care? Here's what we know. As little as 8% stretch the sciatic nerve, which is sensitive in this case, if you're watching this video, most likely, reduces blood flow or blood supply to it. And as little as 16%. So if I had a string here and, you know, or a rubber band, and this was 100%, right? And this was 8%, 16, right? A very little stretch on the sciatic nerve can actually cut off the blood supply to it. Why do we care? We care because what's carried in the blood? Oxygen and nutrients, right? And so nerves that are irritated or attempting to recover, or really any tissue for that matter that's trying to recover, really enjoys a fresh and consistent blood supply. Let's not try to cut it off by compressing it or stretching it. Next, we want to teach you how to self-assess, or sort of pretty much around the same time. The early process is to optimize things mentally and physically. We just talked a little bit about that, but then give you a way that if you are dealing with strength loss, either your ability to go up on your toes or walk on your heels or get up from a seated position, a sit to stand, then we need to track this. We need to measure this to tell if we're going in the right direction and if what we're doing is working or not working or making us worse. You can't manage what you don't measure is the saying here. All right. Now, this is just an example, but it's time to get creative. There's an individual named Remy that I worked with, calf weakness, how to measure. I asked him when he started to experience calf weakness to begin objectifying so we could determine over time what was happening. So he said, I developed severe sciatica symptoms on my right leg in December 2023 after a herniated disc back in October. 2 weeks ago, his calf went weak as he was starting to improve pain-wise. Earlier, we talked about how if you have lumbar radiculopathy, you can have weakness with or without pain. His started as radicular pain, no weakness, right? Just shooting pain, raging pain down his leg all the way into his foot. And then he started to develop weakness, radiculopathy, but his pain faded, his radicular pain calmed down. So sometimes you'll see this. His symptoms were improving, less pain, right? But his weakness became sudden and increased, right? So his calf went weak. So as the saying goes, you improve what you measure. You can't manage what you don't measure. And I wanted to get a comparable measure of weakness to know whether I was improving or worsening. Super smart, and this is what we helped him with. Since the first observation was that I could no longer stand on my toes, that's how it showed up for him. This is a test we walked you through earlier to determine he had an S1 nerve problem. Since the first observation was that I could no longer stand on my toes, using a regular scale, I try to put as much weight as I can without the heel collapsing. I try to be as static as I can and don't obsess with the decimals. Just try to track roughly where I'm at. See the picture, you can see it here, all right? This is probably not doable for those with the opposite foot drop and an L5 prop. But if that was me, I would use a travel scale, the ones where you hang luggage off of and lift with some elastic bands. Pretty sure it would work, but I've never tested it. This method has allowed me to know where I stand. No pun intended. Couldn't stand. At the beginning and for the first 10 days, I could put 30 kilograms of weight on it. I'm happy to say it for the last 5 days, I've been hovering between 40 and 50. So I know I'm on the right path, and that gives me some confidence, turns the freak out meter down a little bit. Hope this helps and have a great weekend. So I wanted to share it with you because, again, you can optimize things. You can do all the right exercises, the stretching, the strengthening, whatever it ends up being for you. But if you're not measuring what's happening with your body, then how do you tell if you're moving in the right direction or not? All right. So apply this concept to what you're dealing with. All right. So again, let's go back to the hypothesis that we started with in the beginning of the video. If I feel loss of strength, then strengthening will make me stronger. Well, it really just depends, right? In summary, if you're experiencing weakness due to lumbar radiculopathy, this unhealthy nerve, strengthening is unlikely to provide improvements in strength because weakness is not muscular in origin, but rather due to a block of nerve conduction or signals being delivered to that muscle that you're trying to strengthen. In fact, strengthening may slow healing, as attempting to strength train may create an environment that either overtaxes the area, right, but is not conducive to nerve healing. We talked about why. Maybe you're doing motions that hurt and continue to inflame the nerve, which is leading to the conduction block, right? Now, if you're experiencing an angry nerve without strength loss, without objective strength loss, then strengthening may improve your strength. But because of the lack of correlation between strength and pain, it may not reduce your pain. So again, be careful of that belief of like, well, I feel weak, and because I feel weak, and because someone said I'm weak, and if I just strengthen my glutes, then my pain will go away. I wish it was that easy, all right? You can strengthen your glutes, and strengthening your glutes might actually be putting you in more pain or causing more problems because it's recreating yuckiness and causing an inflammatory cascade, which is not allowing your nervous system to heal. So we need to find safe inputs, right? Now, you might be watching this and you might say, I know it's probably creeping up in your brain. Well, I have weakness. You might go into freak out mode, just like Remy did, right? The freak out meter. Do you need surgery, right? So Remy didn't need surgery, all right, even though he had sudden weakness where he could not go up on his toes, all right? And then many other people have not. So Jamie, a member of my program, created something called the Glute Relief Accelerator Program to teach people like you how to resolve these problems naturally. MRI result, disc collapse and nerve compression. Look at that MRI. Just had results back tonight. Shows clear disc damage where the disc is collapsed and is pressing on the nerve. I've been in extreme amount of pain, radicular pain, right? Butt and leg pain over the last couple of months, and would explain this as a structural issue. Has anyone else experienced this, right? He was advised that he would need decompression or discectomy surgery, but it's super expensive, right? And so here's his image. Look, he's compressing the nerves clearly, right? And not only does he have radicular pain, but he also has radiculopathy because now he says, feeling back. Little success story, the severe numbness. So he had true loss of feeling. Remember, true loss of feeling or true loss of function in the strength terms, right, ability to go up on your toes or walk on your heels or whatever, points to a nerve conduction block, either of the sensory fibers, the feeling fibers, or the motor fibers, the movement fibers. In this case, for him, it was mostly the feeling fibers. And even though he had that conduction block causing a lack of feeling, as he followed the process, optimized the healing environment, started to measure and track things, and took things systematically and scientifically, finding what works for him, he no longer does. So quite severe numbness in his foot and the back of his leg, which is pretty much gone. I'm not able to feel most of his foot for around 3 months. I can now visibly see the blood circulation. Majority of feeling is back. I know that all this weird, sometimes intense buzzing and tingling sensations that have been going on for a couple of weeks has been for a reason. Our bodies are amazing onwards and upwards. Avoided surgery. All right. So despite having lost the strength or feeling, most people still recover just fine without surgery. As the body begins to heal and swelling is reduced within the nerve, compression resolves and the nerve begins to heal. Just monitor your strength like we talked about earlier and feeling on a weekly basis to ensure that nerve function is returning, right? If feeling and strength slowly begin to return, it's a sign that your nerve is healing, right? So maybe you have an area of numbness or a patch of numbness on your leg that's this big, right? But if next week it's a little bit smaller, then you're moving in the right direction. If you can only put 30 pounds or 30 kilograms, depending on where you're watching this from, on the scale, but then next week you can put 40 and then 45 and 50, you're moving in the right direction. You're not moving in the wrong direction. That shows a gain of function, a healing of the nervous system, a reduction of the compression, right? So understand there's little evidence to suggest that surgery for sciatica also must be urgent, right? So you hear a lot of this. I have weakness. I've got to get in. I've got to get an immediate appointment, maybe or maybe not. So we looked at this article, timing of surgery in lumbar disc prolapse, systematic review. At this stage, it's felt that time alone should not be the basis for recommending surgery. Hence the practice of telling patients that they need urgent surgery for pain or you're going to be paralyzed or something like that, right? Has no scientific basis. All right. Or there's very little evidence to suggest that having surgery relieve sciatic pain has any clear long-term benefit over just natural treatment and following a process like we teach folks. All right. Prolonged conservative care versus early surgery in patients with sciatica caused by disc herniation, one of the most common causes of compression for nerves that lose function. All right. They looked at 2-year results of this trial. And what they found, you can see here, right, that the line in purple is for people who went the natural treatment route. And the line in red is the early surgery route. All right. And then this is time. All right. So this is disability and pain, if you will, on the left side. So pain on the left side and time going left to right. And what we found here is that, yeah, you can see pain reduce faster if you get surgery. The red line drops quicker, but at 6 months and at a year, you see very little to no difference between the two. So studies show that surgery for sciatica does seem to result in quicker relief of leg pain than no surgery. However, outcomes are no different for back and leg pain or function at 6-month, 1 and 2 year marks. All right. So in simple terms, studies show some evidence for quicker pain relief surgery, but long-term, those who choose it versus those who choose natural treatment do just as well. And obviously, there's essentially no risk. Okay. So look, this is the 4-step pain relief process that we teach. We first have to optimize the healing environment mentally and physically so you can create an environment that is conducive to the health of your nervous system being restored, which then will restore strength to the muscular system. All right. Then we teach people, kind of like we talked about, how to self-assess. Maybe it's assessing the strength. But there's also other ways you can go about assessing, such that week to week you can determine if what you're doing is working or not working. Then we can talk about using movement as medicine to further accelerate the healing process, to find motions that not only feel safe, right, but that decompress, if you will, the sensitive nervous system or the nerve that is a bit unhealthy. And then finally, want to get you back to life and back to full speed, giving you all the knowledge, tools, and understanding you need, not only now to get out of pain, but then also long-term. What can you do to give yourself the best chance of preventing this in the future? All right, so look, if you're watching this video, that answers the question of should you strengthen or should you not, right? We talked about the 2 kind of types of sciatica, one where strengthening might be valuable, but don't get locked in the belief that, hey, just because I can strength train and all my wires are perfectly functioning, that means I'm going to get out of pain. Be careful with that belief system. Then we talked about, all right, radiculopathy, right, where there's an objective loss side to side of strength. And you can try to strengthen all you want, but because the problem is not muscular in origin, but instead due to an impaired nervous system, we want to optimize healing for the nervous system rather than just focusing on strength. Doesn't mean that you can't try to strengthen. Just be careful that you're not doing more harm than good and overtaxing the system, which is trying to heal, the real source of weakness. All right. So hopefully this was helpful. If you're looking for a step-by-step process, this is one that really works. All right. And you would be interested in learning how to resolve your pain now and in the future, and you're tired of relying on other people and trying a bunch of random things without results, go ahead. Again, we work with people all around the world. with back butt sciatica problems, feel free to click the link in the comments and or the description below. I would be happy to review your case personally to see if we can help, how we can help, and start to lay out that plan. Click the link below, set up a time to chat with us, follow instructions to submit a detailed case review, and I will review that personally. Thanks so much, everyone. Appreciate checking this out. Be sure to comment, let me know your thoughts below, and then subscribe as well. Thanks.